Welcome to iSpa Talk, where we educate, empower, and encourage women to practice safe beauty habits, starting with their eyes and skin. I help you connect the dots between beauty and science. Some say your eyes and skin say more about you before you open your mouth. My name is Dr. Janelle OD. I'm your host and the CEO and founder of Bring Eyes Vision Center and Premier Dry Eye Spa. Thank you for tuning in. Let's chat. Hey, how's it going? I'm Dr. Janelle. I am the Dry Eye Mentor. I am going to be your host for today. I have a passion for all things optometry, but I have a special passion for dry eye and ocular surface disease and optometry aesthetics. And so on my show, iSpa Talk, I help you connect the dots between beauty and science. So we're going to jump right in today. I get this question all the time. Doc, is my skincare routine or the makeup I'm using making my eyes more uncomfortable? Is it causing my dry eye? Or I have patients tell me, my eyes have been so irritated. I don't know if it's my makeup or my skincare product, so I just threw everything away. And so this is a great opportunity for us to have a conversation because no, you don't have to go and throw everything away. But in some cases, you may have to if everything in your cabinet that we're going to discuss is bad for you. But we're going to talk about what you should be looking for and kind of what you should avoid and conversations you should have with your eye care provider, your optometrist or ophthalmologist if they're treating you for ocular surface disease. So that way we are managing the entire problem, because if we're addressing one thing in the clinic, but at home, something that you're possibly doing for your skin at night or your makeup that you apply daily could be exacerbating some of your conditions. So it's not a direct yes, and it's not a direct no. So we'll get started. We'll start first with your morning. Most of us are getting up early in the morning and we're applying probably some facial creams, some UV moisturizers, and then we're applying our makeups. So we'll talk about first what you want to look for in a makeup, or really to avoid in a makeup that may exacerbate your eye conditions, how often you should be throwing your makeup away, and maybe some tips of what you should completely avoid doing. So first, we're going to talk about things that you should look for or avoid in your makeup. So this is going to be your shadows. This is going to be your liner, your mascara, anything that you're putting around your eyes, your false lashes. You want to make sure that those things don't have fragrances in them. The fragrance may not necessarily cause dryness or meibomian gland dysfunction, but it can cause an allergic reaction. Most people know if they're very sensitive to different scents or fragrances. Like me, I'm not a person that wears a lot of perfume or scented things because my body just does not deal well with it. So you very rarely will see me or smell me walk into a room. You know how some women especially, like, oh, wow, she's here. You will never. You got to be all on me to know that I have a fragrance on. And so that same type of person, I'm going to make sure whatever I'm applying around my eye does not have any fragrance in it, because that's not going to be a positive response. I'm probably going to get some tearing, some redness, some burning that's going to make me want to take it off. Okay. And if there have some patients who will push through that, oh yeah, every time I put my makeup on for 15 minutes, it just burns, it's tears and it's red and it clears up. Don't use it. It's not a push through. You should put it on and feel good and look good. Not, I got to push through 15 minutes and then I'm good. That means that there's some kind of fragrance in that thing that you're applying to your eye that is not comfortable and is not agreeing with your eyes. Another big one you want to avoid is parabens. You want to make sure that there are no toxic parabens in your makeup. A lot of cosmetic skincare manufacturers are getting on the bandwagon where you're hearing in commercials, or you will see on the box or the bottle, no parabens. We do know parabens are not anything positive that should be constantly around your eye or your face. So you want to look and try to avoid those if possible. I'm going to post a list a little bit later in the comments so that way you can see a full list. But I'm just trying to go through a few things that I know right off the bat. If you have some ocular surface issues, it's going to exacerbate things. Preservatives. So you want to try to have something. Most of the things are going to have preservatives in it. That's why you're able to use it for an extended period of time. But you just want to make sure that there's not a litany of preservatives, especially any preservatives that has like BAK in it or thimerosal. Those type of things have been known to cause ocular reactions and irritations. They were found a lot in contact lens solutions. Sometimes they're in your makeups, and a lot of drops that you use. So you want to look out for that. Some patients already know that they have a thimerosal or BAK sensitivity, and they will communicate that. Some patients don't know. So sometimes if you put something around your eye and you get that immediate response, look on the bag. There may be some thimerosal, some BAK, or some preservatives that you're just sensitive to. And another big one is formaldehyde. Yes, formaldehyde, the same thing that we put in dead bodies. You want to avoid that if all possible, or make sure that the amount that is in this product that you're using is as reduced as possible. And then also, if you're participating in magnetic liner, so you have to put the magnetic liner on. So you want to have a magnetic liner that's going to have the lowest amount of iodines as possible, so that way it doesn't exacerbate any current ocular issues that you have or cause any irritation on the front part of the eye. So let's talk about what you shouldn't do, and specifically with mascara and liner. I think most people are normal with mascara. That means you put the mascara on your lash. I usually don't like to go underneath, because underneath, so right on the lid, right at the bottom, and right at the top, on that thick lid margin there, if you got really close and had a hand mirror, you will see these itty bitty holes. And if you're lucky, those holes are very visible. There's not a lot of inflammation or redness around them. There's not any white clogs on top of them. That means you got a healthy lid margin. But the thing is, you don't want to put anything directly on those glands, on that lid. So if you wear any liners, the liner should not go directly on the inside of the part of the eye that's slimy. It should go underneath if you're going to wear a liner on your eye, not right on that lid margin. I used to do that back in the day. I didn't know any better. When I say back in the day, I was like 16. It's rampant now. And clearly it's not obvious that it's not anything that you should do daily. If I do it, and that's a big if, it's really something going on. And I haven't done it in so long that when I try to do it, immediately my eyes are like, sweetheart, you know you're an eye doctor and you out of order, because my eyes are watering, they're irritated. And I'm just like, how the heck do people do this? And I used to do it daily. Like back in the day, we would get the black liner, we would heat it up, melt it a little bit on the stove, and it stop. Because those are your oil glands. You're clogging those oil glands up. If you're already a person that has meibomian gland dysfunction or has dry eye disease, that's an absolute no-no. And definitely not on the top. Do not do that. Do not do that daily. If you must do that, let it be for your wedding. Let it be for prom. Once a year. That is absolutely something you should not be doing daily. Okay, let's talk about how often should you be disposing of this makeup. Definitely not when hell freeze over. Okay. Some of you right now, just go ahead and pause the video, go into your makeup stash, bring it back, unpause it, and just start going through your makeup bag. If you have makeup in there that you're like, I got this when I was married, and you've been married 15 years, it is time to throw that away. Okay. Low key, it's been time to throw it away. And so on average, you should shoot to every 4 to 6 months throwing your makeup away. Earlier, the better. Specifically, things that are constantly around your eye, that you're touching your eye and putting it back in that tube. So like your mascaras, your liners, your shadows, you should be throwing that away. They recommend monthly. That is tough. So I say we're work in progress. God is not done with us yet. So let's shoot for 6 months and then work your way back. There are new products on the market that make it a little bit easier for you to remember when to throw away your makeup. Check out Eyes Are the Story. They have it really cool where the mascara comes in these 3 little mini sections, and the mini sections are designed to last a month, and you get 3 of them. So every 3 months, you should be starting with a new set of mascara. That mascara is great. It gives you the volume that you want, and if you have ocular surface issues, it does not irritate your eyes. I wear that. There's another one that I wear that's called OcuSoft. It is for sensitive eyes, so it's really great for patients who have ocular surface disease. It is not in a mini bottle, but it's in a regular bottle. So that one, once you open it up, you need to mentally know, okay, about 3 months, I need to throw this away. Honestly, if you're wearing it every day, when it gets hard and you're scraping the sides, it's time to throw it away and go purchase another one. So what I recommend that you do, purchase a couple at a time. Everything is an investment. It costs to be the boss. So you purchase a couple at a time. So that way you're not forced to continue to wear something that you know is old and you had it since the last time you got an eye infection. And that brings me to, if you ever get diagnosed with an eye infection, especially an eye infection that's associated with contact lens wear, then you need to throw all that makeup out and start over. So that's a hard stop, pause, throw out, and regroup. But overall, your goal should be throwing those things away no more than 6 months. 3 to 4 months is a better range, but I know that takes some time to get going. So let's talk about skincare. Can what you put on your skin at night affect your eyes, especially if you put any serums and things around your eyes? A lot of women do this nightly, especially women who are 40 plus. And so now we're looking at wrinkles, we're looking at puffiness, and we're doing things, to minimize that, especially if you're not interested in any fillers or in injections. I don't currently right now offer those in my office. I have in the past. I'm looking to do that again in the future. But I just want to get, if you're interested, if I get enough poll, then I'll see if I can partner with someone to bring those services in. Personally, I'm not interested in those services, but I don't have a problem with doing serums, or different things around my eyes. So you want to be careful because the skin and the tissue around your eye is some of the thinnest skin and tissue. And things can penetrate right from that thin tissue to important structures that live in the lid and glands, especially your oil glands and meibomian glands. So a couple things you want to avoid is aluminum. Look on the back. Make sure there's no aluminum in the back of your eye makeup. Same thing, parabens. You don't want to have any parabens. So if you see parabens, you want to minimize that as much as possible or avoid that. PEG, polyethyl glycol. So anything with a col or alcohol, you want to make sure that you minimize the concentration of those or avoid those altogether. And then same thing, avoid any formaldehydes or excessive preservatives. Once again, I'll put a full link of this. I'll add on a slide that has a link to this or list it out so that way you can see. If you have any additional questions about these lists, then what you can do, you can easily contact me at eyecare.drjanelleod.com, and I can answer that question. I'm on all social media platforms, or you can send me a message in the DM. And also this will be posted on my YouTube channel, The Dry Eye Mentor. And so you'll be able to get the list. So if you want the list, you can have it. What are some positive things that you can put around your eyes? Because you probably think, okay, you told me everything bad. What can I do? Positive things. I usually say most of the things that your grandmother and mother told you that was healthy will help you grow and make you strong are some of the same things that you want to eat and put around your face. So vitamin C, vitamin E, those are awesome antioxidants. Hyaluronic acid, what that does, it just sucks in moisture. A lot of times your skin is dry and irritated, just like your eyes are irritated. So it needs that extra moisture. Pycnogenol is a very good product, natural product that help to lift and brighten your skin. Anything that's going to be UV protected, you want to minimize the amount of UV exposure around your eyes and protect that skin. We all think of sunglasses, but you want to make sure you wear sunscreen, especially my women of color. We tend to think that our melanin, it has superpowers. It does a lot and it protects us from a lot. That's why it takes a much longer time for us to experience wrinkles and a lot of different things, unless we just grew up around intense sun. But it's not Superman, the sun, our skin is susceptible to sun. So we do have a kryptonite. So you do want to make sure that you are actively wearing sunscreen and creams that are safe around the eye. One product that I like is Oculair. If you've been following me, since last year, I've been talking about Oculair. It's finally hit the market. It should be full force out for everybody to get. If you want questions about Oculair, it's a skin care product that is safe and designed for individuals that have ocular surface disease and meibomian gland dysfunction, because nothing in those products are going to exacerbate your eye condition. And the plus is it was formulated, designed, backed by eye care professionals. And I happen to be on the advisory board. So as a disclosure, so the advisory board is made up of optometrists, ophthalmologists, dermatologists, oculoplastic specialists. So everybody that deals with the skin, but specifically around the eye. So right now you can find that online at oculair.com, and you want to think they're going to have a locator, because there are going to be some doctors that have these products in their offices. They have eye serums, they have creams, they have whole systems. I do use these products as well. So if you're looking for a safe product to help with anti-aging and give you a skin routine at night, Ocular is a great place to start. Skincare products, you don't have to worry about keeping those too long, because most of us use those day and night and they're going to run out. So very few times do we keep those too long. It's just our makeup. So if you take anything away from the conversation today, is if you go in your bag and you say, oh, I got this when I first had little Jimmy, and little Jimmy is 13, that's throw it in the trash, man. And that's going to help minimize. So can my makeup or my skincare routine cause my dry eye or make me have dry eyes? Not a hard yes, not a hard no. It really depends on what you're doing, what you're using, and how you're doing it. So just because you have dry eye, ocular surface disease, or meibomian gland dysfunction does not mean that you cannot partake in makeup and beautify your skin. You just want to make sure you're using products that are not going to exacerbate any conditions that you have. If you are being managed by a dry eye specialist, ask your doctor what they recommend. If they're not sure, then hit me up, because in those spaces I can give you some recommendations of which are going to be safe for you. So once again, my name is Dr. Janelle OD. I am the Dry Eye Mentor. I help you discover the root cause of your ocular discomfort and get you on the road to younger, clearer, wider eyes. And here at iSpot Talk, we help you connect the dots between beauty and science. Enjoy the rest of your day.